I'm here in the beautiful Indaiatuba in Brazil at my brother's house, enjoying my holidays over the winter in Canada and it's summer here in Brazil. And it's lovely. However, in the middle of my holidays, I was attacked by shingles. Yes, varicella zoster got me. And I'm taking antivirus medication. It's very painful. But I hope I don't develop post-herpetic neuralgia, which is a type of chronic pain. Zoster is the virus of chickenpox. I had chickenpox when I was a child. And what happens is the virus remains in my system, and when the immune system drops for some reason, then the virus develops, grows again, multiplies, and attacks one of the nerve roots. In my case, attacked the S1, the sacral one on the right side. So the first symptom that I had was it started with a pain inside of my thigh, like a hamstring pulling muscle. I had a straight leg raising positive. And I tried to stretch. I thought it was a muscle pain, but it didn't go away. And 3 days later, boom, the lesions in the skin appeared. And then I said, okay, this is shingles. The lesions in the skin are like, there's a redness in the background, and then there's vesicles that are full of virus. And I'm not touching, I'm not scratching, it's itchy, and sometimes it looks like a burning sensation, but I'm not touching. But I'm applying a cream. The cream contains aciclovir, which is the antivirus medication. Other than that, I'm not doing anything at this point, and the lesions are forming some crusts. They are forming they're healing, and they can be very itchy, but I don't touch and I don't scratch. Zoster actually cannot be transmitted. Even though it's a communicable disease, I can't transmit zoster to anyone else. However, the virus that causes this is the chickenpox virus, so I can transmit chickenpox to someone who didn't have it. But we know that 99% of the population, the adult population these days, they had chickenpox when they were children. And nowadays, children get the vaccine for chickenpox, so they don't actually get chickenpox, but they get vaccinated. So the chances of someone getting chickenpox from myself is very low, because they either had chickenpox and they are immune, or they had a vaccine and they will not be able to get it. And but I can't transmit zoster to anyone because zoster is not transmissible. Only people who had chickenpox can develop varicella zoster. If a person was vaccinated by chickenpox vaccine, they can't develop zoster in adult life. So the pain that I have is two kinds of pain actually. One is a pain in the inner thigh. It's like a pulled muscle, like the hamstrings, very tight. And the other pain is in the skin. The skin is very sensitive. It's a kind of burning, itching, and I am applying a cream, and I'm also taking antivirus medication, valacyclovir. And I should have taken the vaccine. Actually, I didn't. I tell everybody to take the vaccine, but I didn't take it. The vaccine is indicated for people over 50, and I just turned 58 months ago. I should have taken the vaccine, yes. And I didn't, because the vaccine prevents this shingles from happening, and also if it happens, it prevents post-herpetic neuralgia, which is a complication of shingles that happens in 20% of people. I am dealing okay. It's okay. I can walk, I can sleep well, in fact, but sometimes it's hard to walk, it's hard to go up and down stairs. It's not too much. The pain gets better with Tylenol. Actually, I'm taking Tylenol 1,000 milligrams, and the pain is a lot alleviated with plain Tylenol. I took Advil once, 400 milligrams of Advil one day, also helped. But I don't want to take too much Advil because of the kidneys. The valacyclovir can be toxic to the kidneys, and Advil can also be toxic. So I don't want to take two medications that can be toxic to the kidneys. So I'm taking Tylenol 1,000 milligrams when the pain is unbearable, and the antivirus for 7 days. But the reason that I'm making this video is actually to tell people to take the vaccine. I should have taken the vaccine and I didn't. There are 2 types of vaccine in Canada, and when I go back to Canada, I think I'm going to take it. I was reading about it, if I should take the vaccine, even if I had zoster, should I take or not? But apparently taking the vaccine is a good idea because it can prevent further episodes of zoster. And I will take, once the skin lesions disappear, maybe in a week or 2, and then I will wait another few months and then I'll take the vaccine. And there are 2 types of vaccine. One that is older, it was developed in I think 2006. This vaccine provides protection of about 50 to 60% to varicella zoster. And the other one is newer. It's about 3 years old, and this vaccine is much more efficient. It protects in about 95 to 97%. So the second one, the newer one, seems to be the best vaccine to prevent varicella zoster. And anyone who is above age of 50 should take this vaccine. So I highly recommend everyone to take it because zoster is actually something very serious. And I was reading, it's very common. It affects 1 million people every year in the United States. So it's a lot of people. And if we think that 20% will develop post-herpetic neuralgia, which is a type of chronic pain, that's a lot of people every year that can develop chronic pain. So having the vaccine available, take it. Please take the vaccine. That's an advice that I give to you that I didn't do myself, and now I'm learning the consequences. But please go and take the vaccine, the zoster vaccine, as soon as possible if you are 50 or above, or if you have any other condition that even if you are below 50 years old, but your doctor recommends you to take the vaccine, go ahead and take it. Then it looks like the predisposing factors for shingles is when the immune system drops. And in my case, the only thing that I can relate is that I was taking a lot of sunbathing. You can see I'm a little tanned from the sun here. And it was very hot a few days ago. It was 35 degrees down here. Today is overcast and it's nice, but a few days ago, a week ago, before my shingles started, I was under the sun and trying to get some suntan, but maybe that's what caused my immune system to drop and this episode of shingles. So I love this place. You can see some cows and some farms over there, and there are lots of birds, different birds here, and trees. It's lovely here. This is the city of Indaiatuba. Hi, I'm back to Canada. As you can see, I'm here and it's a snowy day. And today it has been 3 weeks since my shingles started. So I'm going to tell you a little bit about what happened after I came back. So the blisters started healing and they formed scabs. And in about 10 days, they were all scabbed and the scabs were starting to fall off. I checked with the occupational health nurse at work to see if I could go back to work, and she said yes, because I'm not transmitting chickenpox anymore, so I'm not contagious. And I've been also back to the gym. I have been twice to the gym and be able to do my exercises. And I finished the antiviral 1 week medication that I took, the antivirus medication. And when I came back here, I still had a little bit of the skin pain, and now it's more itching. What I have now is itching. I'm using a cream that I bought in Brazil, and it's a topical cream that helps with the itching and with the hypersensitivity in the skin, and also helps healing the scabs. And The pain, I still have a little bit of pain dipping my muscles. That's a little bit of muscle pain, myofascial pain, a little bit of neuropathic pain, because I started feeling some pins and needles and stabbing pain. And then I started getting worried. This was about a week ago. I started getting worried that I would develop post-herpetic neuralgia. And I had a prescription for pregabalin that the doctor in Brazil gave to me. And I was thinking, should I start on pregabalin? Should I not? And I called a friend pharmacist who helped me immensely to think about if I should start or not. And she helped me to look at what are the risk factors for developing post-herpetic neuralgia. So one of the things are older age. If a person is above 60 or 70 years old, the chance of developing post-herpetic neuralgia is higher. If the person the acute pain is very severe, also that affects higher the chance of post-herpetic neuralgia. And also if the skin rash is very severe. So in my case, the pain was not so severe, the skin rash was mild to moderate, and I am 50 years old, so I said I'm not in the high risk group. I don't have any immune problem, immune suppression, which is another factor that predisposes people for post-herpetic neuralgia. And so I decided not to start pregabalin. At that point, the acetamin and ibuprofen and dipyrone, they were not helping with my deep pain because it was more like a neuropathic and myofascial pain. So really what helped me a lot was applying TENS, the transcutaneous electrical nerve stimulation. I applied in my lower back here, and that was really excellent because I could work, I could concentrate on the things that I had to do while the TENS was on. So now I'm not taking any medication. My pain is very, very minor. I've been able to go back to the gym. I did not start pregabalin, and 3 weeks later, I would say that I'm very happy with the results. And again, the things that we can do to prevent this from happening is the vaccine. And I regret that I didn't take the vaccine. Actually, I should have taken, and I recommend people to do it. I didn't. And I have to wait 1 year to take the vaccine, and I will take because apparently having the zoster does not protect me completely from having another shingles. And the new vaccine that exists now protects 97%. There are 2 doses and they protect 97%. So yes, I'm going to take. So thank you for watching. Remember that this video is not intended to provide medical advice. If you think that you have a medical condition causing you shingles or post-herpetic neuralgia, consult a physician to have a proper diagnosis for you. This video is only for educational purposes. Also, if you like this video, don't forget to like it, to subscribe to this channel, to leave your comments and questions, suggestions. I also tweet. I have a Facebook page and an Instagram account. You can also contact me there. Thank you for watching. Bye.